All right, everybody, welcome to another edition of What's What BR. Today we have Mark Muller, who is Senior Vice President, Strategy and Business Development, Ochsner Health. How you doing, Mark? How are you?
Great. Great to be with you, Brandon.
Awesome. Glad you could pull some time. Obviously, this is not kind of the decor of your home here, obviously, but looks like you're at one of the hospitals, one of your admin buildings. So we're going to appreciate you taking some time, come to visit with us and kind of let us know what's going on.
Thank you.
So diving right in for time's sake, you're in the healthcare space, so we're not wasting anybody's time there. Obviously, these days we're in. You guys have been putting together and you've been kind of championing some of this, and Ochsner Health has really stepped up, not just in, with their own employees on the healthcare in general that everybody knows where we are, but in an effort to get people back to work and be prepared, for employers and what they possibly can do. So much so that you guys, I got my hands on a copy of the, safe return to work, this toolkit, this framework you guys put out last week. And from what I understand, it's been out a week, but this has just grown and kind of consumed, what you've been working on. Can you tell us a little bit about that?
Yeah, it's, we're all learning throughout this crisis. So when this first hit in the middle of March, we started doing weekly webinars with employers and just trying to be a resource, provide education about the virus, answer questions, have our infectious disease physicians on there, and just make ourselves available because people were scared, they were nervous, and they didn't know what to do and they didn't know who to turn to. So we've been doing that for a couple of months now. And through interacting with employers, it was clear that they didn't really have a plan and they weren't sure what to do. And so we went through this first phase of kind of trying to understand the virus. And the second phase was everything was kind of shut down. And now it seems like we're entering this third phase in anticipation of hopefully a May 16th, at least gradual start to reopening the economy. And so now very quickly, employers have got to figure out, how do I reopen my business? How do I restart my business or expand it, bring my staff back who may have been working from home? And how do I do it safely? And so I think there's two parts to this. One is, what measures can I take as an employer to provide a safe workplace and working environment for my staff, my customers, everybody who might come in. But also then, how do I build and communicate what I'm doing in a way that builds a perception of safety? Because at the end of the day, everyone's perception is our reality. And so if I don't feel that it is a safe workplace as an employee or as a customer, then I'm going to be hesitant to venture out. So I think we're at this strange little transition point in our society here now as we try and get our economy back up and going. And if we don't do that soon, it's going to be tough for all of us, certainly.
Absolutely. I was speaking to a group a couple of weeks ago, and was telling them I recently went to go learn to fly airplanes, and there's 3 rules kind of in the beginning. It's called, aviate, navigate, communicate. And I kind of equated that to, kind of what's going on here and from employers. And so, kind of the concept was, is aviate, which is, as we say in the airplane world, job one, no matter what, is fly the airplane. You have to keep flying. Employers and business owners, we still have to continue, business. We can't, there's not a just stop, and I'll pick this back up in 90 days. So, we have to, aviate, we've got to continue doing. And then navigating is, how do we get through this? And what do we do? And what are the steps to bring people back to work? And how do we change the way our business operates? And how do we do this? And how do we do that? So you've got to navigate your way through this. And then one of the things you mentioned, which may have brought this up, was communicate that back out. You can do all the cleaning in your building, that you possibly want to do. But if you don't express to, your customers, to your employees, like, here's what we're doing, here's how we're doing it. And this is not on our own authority because we're not the experts in, health. And we're taking our cues from Ochsner's, which just so happens to be the largest healthcare provider in the state, is helping us along this way. That's kind of the 3 things that I think are critical for people.
Yeah, it's like there's no real good housekeeping seal of approval for this today, right? And so what's that going to be, and how do people know? I think it's about how do you instill confidence in people. We're going through this, at auction. So we've had this weird dichotomy, right? Where on one hand, our ICUs were full at the height of the crisis. Fortunately, now we're on the other side of that, and things are better. But at the same time, all the elective surgeries were shut down, and so we're just restarting that. We're kind of rescheduling tens of thousands of patient appointments into the clinics. Labs were put on hold, diagnostics were put on hold, and so everything that we're trying to be a resource and bring as tools to employers, they're the same things that we're doing here at Auctioner every day, because we're all under the same challenge. How do we build a perception in the public that on one hand, this virus is still here and it's probably still going to be with us for quite some time to come. On the other hand, people still have needs, and all their other healthcare needs aren't going away magically. They're still there. And so we've got to go back to work and to business, but we all have to do it safely. So the question is, how do we do that? And it's going to be different than it was before, but what are the practices, the real measures that we can take, each of us, and adapt those to our workplace to make it a safe environment? And there are many things that we are doing and can do, and I think that's what we're talking about.
And I think that's what's so great about what you guys are doing and stepping up and putting these. It's not easy to put together a 30-page document of medical sound advice and best practices and offerings that you guys have done, which is incredible. But what I think that everybody has in their business is business. We have an IT disaster recovery plan. We have the plan for physical facilities if there's a gas leak or if we've got to evacuate people. We have those plans. I've been talking to a lot of people over the last 2 months. Nobody has said, yes, we inactivated our pandemic plan and we're on step 3. Right now, nobody has the blueprint on how to do this, of what to do, much less, okay, now that we're working towards, we think we're starting to see the other side of it. What do I do? Do I temperature check every employee at the front door? How do I eliminate that?
Yeah, and so if you've noticed in the last, really just in the last week or so now, parishes, cities, major metro areas, business groups are coming out with guidelines. And to the extent that they can, not quite protocols, but guidelines on, okay, how do we get back to work? And they're providing that generally across businesses, but then also some that are industry specific. And I think that's a great first step, right? That's a good start. But then you've got to ultimately, change it from just guidelines into actually doing it. And I think that's the piece that's going to be hard, right? Okay, so if I'm going to temp check all my employees or customers as they come in, how am I going to do that? Who's going to do that? Where am I going to get all the PPE from that I need? I mean, that's not a normal part of my supply chain, right? If I need to get my folks tested, how do I do that? How do I keep awareness level up, and how do I educate my employees on what to do and what not to do? So I think going from advising and providing guidelines, which is a great start again, but actually now implementing a plan, developing a plan and implementing it so that you can be ready potentially for Monday, May 18th. I mean, that's coming fast, and that's where the rubber's going to really hit the road. And I think that's exactly where many businesses are at today, and they're trying to figure all that out.
Yeah, I talked with yesterday, maybe recently, a pediatrician, and she has her own clinic, and she was talking about how just as you mentioned, she was like, we would get these guidelines, that would come in, from Department of Health or whoever, different CDC, different places that send her stuff, and she's like, there were guidelines, Then we had to sit down and figure out, okay, what are we going to do? It doesn't say this is what you need to do. This is the rules. It was like, hey, here's some things that, you should do. But she's like, but we had to come sit down, on a Sunday afternoon, as a practice and say, okay, what does this mean? How do we implement this? And I think that's exactly where you're getting at. And what was interesting to me, we talked briefly, I think of Ochsner's as hospital, doctors, clinics. We forget, like we said a second ago, you guys, largest healthcare provider, also the largest employer, here in the States. So you've got to live this, as you said, for your own, staff. Is in the tech world, we used to have an expression. We said we eat our own dog food. So, so, so you guys are figuring this out, but you had mentioned you've got a team that almost, for lack of better words, professional services that are going in and helping businesses do this. We're not pulling doctors out of the ER, to go in and advise you. You got a team that's doing this, right?
We do, and we've got a great team. So we've assembled a team of nurses with corporate wellness background, combined them with infectious disease physicians who are experts on communicable diseases like this. Also with occupational health physicians, so physicians that are skilled in workplace, returning to work, fit for duty tests, everything related to the workplace. And then we've also taken them with quality and safety experts. So people who are skilled at doing site assessments and passing surveys and certification tests. And we're actually combining them and taking teams on site, because what we're hearing from larger employers especially is, I want you to come on site. I want you to come in and do a walkthrough. We'll guide you as a walkthrough through our facilities so you can get a feel for it. We'll look at all the different access points that we have, all the common areas, the typical flow of people in and out and throughout the facility, the restrooms, lunch areas, eating areas, whatever it may be. And I want you to come in and together with us, develop a plan that works for my facility. So taking these high-level guidelines and now actually translating them into a very tactical and a very clear plan that can be implemented. And I want you to provide resources to help do that. That could be digital resources, right, around virtual visits. Could be physical resources on site to help with temp checks. And it could be marketing and communication, even PR resources, signage throughout the facility that can be very prescriptive, right? How to wash your hands, right? In the restroom, signage right there. I think just keeping the awareness level high. I think the danger in, a potential gradual reopening of the economy is that everybody starts to think, well, it's okay. Everything's back to normal. Everybody's starting to get out, and while we're all looking forward to that, unfortunately, until we get a vaccine, which appears to, probably be in 2021, we're going to go through ebbs and flows of this virus, and it's going to be with us for a while. And we have a new normal, but it's not going to be back to the old normal.
And I think that's important for people to realize is we didn't do anything before. If you rewind and everybody go back to, the office where we were day to day and we were seeing those numbers just climb and climb and climb. There wasn't anything that anyone was particularly doing to make those numbers climb. It was just the actions that we all had. And for people to think that, oh, it's over and we can go back to work, well, you're just putting yourself right back there. So if we're not taking, it might sound silly, some of these wash your hands and here's the instructions on how to do it. We have to actually, our actions have to be different. Otherwise, we could potentially go right back to where we were, because that's literally what we're doing. We all go back into the same building.
Yeah, and the good news is, we've learned a lot in the last 2-3 months, right? So we understand some about the virus. We know how it spreads. We know how to prevent it from spreading. We know how to take precautions against it. So, when this first started, none of us were wearing masks. None of us were worried about social distancing. Nobody had even heard the term social distancing before, right? We weren't checking folks' temperatures every day. We didn't understand what the other symptoms beyond just a fever are. And today we understand all those things. So we know how to prevent it. We know what causes it to spread. And I think that's what we're talking about is, listen, we've got to get back to work. Otherwise, we're going to have, businesses that are bankrupt, cities that are bankrupt, economies that are declining. But we've got to do it safely. We cannot do it the same way that we did before. So how do we do that in a way that we can equip our businesses and our employees to do that safely and still carry out their jobs, and do that in a way where they're not, anxious and fearful every minute of the day?
Yeah, I talked with a buddy we've mentioned, they brought, some of their staff, or they went back into work, and about half the staff was excited to be there and the other half was petrified to be there. And then when they mentioned that, oh, we're going to start letting the public come back in, three-quarters of the staff was, wait, you didn't tell me that. I was just coming here. And they looked, and what a lot of people may not realize, especially, I'll admit, guys like myself in the small business, world, it's the little things make a difference. It might sound silly on here's the sign, in the bathroom of how to wash your hands, but it's the little things add up to the big things. So here's how we're, washing hands. Here's, the antibacterial, the hand cleaner, we've got added a couple more stations, and here's our official rules. If you feel sick, if you do, here's the things. Those are the things that make people feel more comfortable about coming back to work.
Yeah, I mean, honestly, for me, just personally, as I think about, what I do every day, it's about building new habits, right?
Mm-hmm.
New personal habits. And, I've come into work every day since this started. And I work at a healthcare facility, right, with COVID patients. But, every day before you go out in public, you're wearing your mask. I mean, there's just precautions that you take. We're doing Zoom meetings, not face to face. We're practicing social distancing. When we do convene, we spread out. We use our boardroom, and we're all spread out all over the place. It's a weird feeling, but it's what you need to do now. So I think it's about how do we kind of retrain ourselves, and for me, it's about trying to build different habits that make sense today and what we need to do.
Well, tell me some of this. You talked about, the virtual meeting, which I think I've said it a number of times on the show. I love it. Now we can have a meeting. I didn't have to drive down to New Orleans to come talk to you today. We can jump on here. We're perfectly fine. You guys, have rolled out some programs. Some you've had, but now that's even more important. Some of these, virtual visits, that people can do. If you can handle this, with an iPhone, you can see a practitioner now, on your iPhone. You don't need to go to the clinic. You don't need to go there. You guys have this, from when I was looking, 24 hours a day, 7 days a week. You've got physicians sitting there ready to, help people without having to go into a facility with COVID patients.
Yeah, it's the single most phenomenal thing I think I've seen in this. So to give you an idea of just how much this has changed, last year, to your point, we had some capabilities in this area. So we did less than 4,000 virtual visits all of last year, total, for all of Oxygen. This year, we've done almost 4,000 in a day.
Oh my gosh.
So just since the beginning of March, we've done over 100,000 virtual visits. 100,000.
That's incredible.
So, I mean, I can't even compute the growth rate on that, right? So it's, and of course, most of those visits before would have been physical, right? People would have come into a clinic, and now they're able to do that remote. And you can't do everything remotely, obviously. You're not going to do transplant surgery remotely. But it's amazing. And so there's different types of virtual visits too. So the one that you mentioned, we do have a 7x24, like on-demand, like urgent care telehealth, right? So you don't need an appointment. There's nothing that needs to be scheduled. You can literally, hey, I'm not feeling well, go on there and be seen within 5 to 10 minutes virtually. We also have scheduled visits. So just like you would schedule a visit to see your physician, your primary care physician, your specialist, whoever it might be. We're able to do that now as well. So primary care, specialists, urgent care, behavioral health, we were talking about that a little bit earlier. Many of those visits can be done virtually now. And so I think it's a great, it's not for everybody, and it's not for every situation and every symptom, but it's certainly a way to do it conveniently, and a way right now at least where you don't have to go anywhere, and so you can feel safer about that.
I've said it probably 1,000 times since this whole thing started with my, I've got a 12-year-old daughter and 7-year-old twin boys, and they're doing something in the house, or it's whatever it is outside. I'm like, would you stop doing that? I'm not taking you to the hospital, at this time. If you do something wrong, or if you get, it's like, you're just gonna have to deal with it, but it's like, no, not all of it. You can, jump online. And I think that's, it's horrible what we're going through. I'm not, denying that, but the fact now that, like you said, 4,000 telemedicine visits last year to 100,000 since this, where we are, that's access to healthcare. That's what people talk about, that, some people don't get you have it in your phone. It's, incredible. And to be able to, and here's what I think, I'm a tech guy by trade, and I got some other things. I'm just sitting here, you're going, okay, 4,000 last year. I'm thinking infrastructure. And it's like, how do you go automatically just scale to boom, 100,000? That's a testament to to Oshner, we have this capability. We were able to go from a product that was used 4,000 times last year to over 100,000. Like you said, what's the growth rate, and, the bandwidth and the physicians and the scheduling and all of that. And to make that happen overnight is incredible,
Yeah, I do think, that's where our size and scale helps, right? I mean, when you have the size of an organization of ours, the infrastructure, the leadership there, the technical expertise to make that happen, right, so quickly. I mean, literally, you had to reinvent yourself in the course of about a week.
Yeah.
Right. So clinics are shut down. People can't go in. Stay at home mandate, but yet still people, need care, right? So how do you flip that on a dime? And I'd say our physicians and nurses and our IT team, our technical folks, to your point, just amazing to be able to turn that so quickly.
Absolutely. That's, those are things that, like you said, turn it in, a matter of a week. If this wouldn't have happened, if we were just on a regular, May day, and somebody called in, I can imagine the boardroom, where somebody goes, you know what? I think you need to scale our infrastructure to be able to handle everything remotely, everybody be at home, and those 4,000 visits, let's move that capability to 100,000, and I'm gonna need it done by the end of the week. Nobody would have said,
they would have laughed.
We can do this.
Yeah.
It would have been, you're kidding me. There's no way in the world, but that's what happened. Yeah. Literally what happened. So anyway, kudos to those guys, especially say in the IT world, that they're trying to pull that together, and the staff of okay, hey, you need to learn how to do this. Oh wait, now you need to learn how to do this now. And then you need to learn how to do this and be ready. And when does this start? It started yesterday. So get ready, So with outside of that, one of the things I thought was interesting when I was reading through this is this goes even a step further, is online virtual visit, and then, what do we normally need? A prescription turns into, hey, we're going to deliver it for you. Which
yeah, it's pretty cool. We've actually developed this tool with a partner. We have an exclusive partnership with a company called Tyto, TYTO, and so we now have a virtual employer plan. So all you basically need is a space in an employer space, an office, a private area, and they've got a monitor there. So think about like an iPad. But the key thing is it also has diagnostic tools. So the one question about telemedicine has been, okay, well, great, I can hear you and see you just like we are today. but I don't have the diagnostic tools of being in a clinic as a physician or a nurse would have. Well, with this partnership with Tyto, we have an exclusive for Louisiana, Mississippi. You actually have tools to do that. And so you can actually take this diagnostic kit and you can put it up to your chest and the physician can hear your heartbeat.
You're kidding me.
You can have an otoscope and put it in your ear and they can see your canal in your ear. You can have a digital tongue depressor and they can see down your throat.
Oh my God.
So all of those things are now available, and so and this all happens real time. So you can use the virtual employer clinic. You get on within about 5 minutes. You're going to be put into a physician. They're going to take some information, listen to you, understand. They'll guide you through then with the diagnostics, and that'll be uploaded to the physician there, and they'll have those images while they're talking to you on the phone. Then they can diagnose, and all this happens in a course of about 10 minutes. And then to your point, again, because people don't really want to go anywhere, instead of going to the retail pharmacy, we within a geographic radius of all of our pharmacies, you can get free prescription delivery. So you can go from I have symptoms, I don't feel well, to these remote diagnostic tools, to a video visit through telehealth, to a diagnosis, to a prescription, delivery right to your home. And it all happens now virtually.
That's amazing. And I think, it's not only is that amazing, the fact that you can get completely full circle with that, but even if I know there's just some people, and I know some of them that are always worried. They're always worried that there's something wrong, or they've got something. But instead of having to go into the clinic, they can do this and they can check it real quick. Just like that, they can see, hey, is this something? And even if it's something that can't necessarily be diagnosed, but it can be looked at to go, that is something. We do need to see you. You need to get in. This is something bigger. And so for the guys and people like myself who don't always, I don't have time to go to the doctor. I don't have time to, for a visit. I can't go sit there, and something turns into something bigger than what it should have been. You could have caught this early. It's like, take the 20 minutes. And this is something employers can actually get and put this whole kit at the office. Right.
And actually, that's part of our solution for employers. So they get this kit as part of it. They can locate it right there in their facility, make it available to all their employees. It includes the diagnostics that we talked about, and that's all part of this safe to return plan.
And that would seem, that takes care of safety, but, in my mind, kind of in an indirect, not only does it, combat and make that immediate need from we're safe and taking care of our employees, outside of the productivity, them having to take time off, it stops them from that employee from having to actually go somewhere, potentially, get exposed to something and come back to the office. They may not have had anything wrong with them, but they could have gone somewhere, been exposed, and then brought it back. So this is one of those items in the toolkit, for employers to say, hey, this is helping you directly here, but it's also helping you 10 times over, in all these other areas.
Right. And this is one that, isn't just for COVID, right? I mean, you can use this continuously. So, one of the things that we know is that these underlying conditions, right, are problematic when you get a virus like this. And so that's part of what we're worried about is people with hypertension, diabetes, and other issues aren't, they're delaying care because they haven't been able to get in because of this crisis. So, and those conditions, if left unchecked, can have consequences.
So your team can get in touch with you guys, get the access to the information online. I'm looking at, a PDF on another screen over here from you guys that covers, like I said, an incredible amount of information, which looks like, based on even our conversations, it's grown since this document was put together.
It has.
Get in touch with you guys, find somebody, and there is no there's no Energy Star seal. There's no stamp. There's nobody that's going to come in and say you've done this, properly. There's nobody. I've mentioned. I don't know if it's 100% accurate. Probably, I would think statistically, I'm pretty close. I told my kids, that there's no one alive on Earth that's ever been through a pandemic before. Maybe there's somebody, we've got some old, but I think statistically, I'm pretty close.
Unless somebody from 1918 is still alive, which could be.
That's why I say think I'm pretty close. I think they've got some people out there, but the fact is there's no one to rely on. My grandfather and I are extremely close, and I've been able to call him, through my career and say, or even call my dad and say, hey, what is the advice? What do you think? What should we do? There's nobody to call for that, but you guys are stepping up to that call, saying we are largest healthcare provider. We've got, what was it, 26,000 something employees that you're having to do this for your own, and said, not only are we going to take care of our own, we're going to take care of, the community and our hospitals and our clinics, but we've got a team and we're going to come show you how to get ready to return to work and get this economy going, again.
We will. And again, there's no guarantees, but I mean, we'll even, co-brand communications around this. So we'll put our brand, our name in there right next to the employers. So I mean, we will do everything that we can to help their workplace be the safest workplace possible for their employees and for their customers.
And I think what's important on that is, and I'll use myself so we don't, kind of call anybody out. I know nothing on healthcare and safety and PPE and procedures. The best advice I can give somebody is, wash your hands. And I think kind of my personality, I think I like the way someone said it in the beginning, was like, wash your hands like you just ate crawfish and have to take a contact out. That's the advice I've heard. That's the way to do it. And so, that probably wouldn't go over as well in, the bathrooms in our office. But if I tried to go in and say, if I send the email communication to our office that, hey, everything's good, here's some guidelines, people are going to go, where'd you copy and paste this from? You don't know about this. And that's where what you mentioned, kind of from a co-brand to where employers can say, yeah, we manufacture widgets. We don't know healthcare. Ochsner's knows healthcare. We've partnered with Ochsner's to come in and help us put these guidelines in place. So you're not trusting me, widget manufacturer. You're trusting, Ochsner, health. Well, look, I think it's amazing what you guys are doing. I don't know if there's anything, else that you've got. I feel like I've borrowed too much of your time when you've got people to be helping and not necessarily chatting with me on these things. But anything you think that we're missing or that we should make sure people know, how to get in touch with you? What's the...
Yeah, I guess I'll just close, Brandon. Again, thank you for having me on. I'll end the way we started, which is, we're a not-for-profit company. We're here to serve our community. And if we're not here as a resource for our community in a time of crisis, then, we shouldn't be here, right? So that's what we're trying to do. We've tried to listen to employers, listen to what their needs are. We've tried to put a safe to return solution together that can help them get back up and running quickly and effectively and keep their workplace safe for as long as we have this. We recognize that, there are a lot of flavors and shapes and sizes of employers, so we've tried to do this in 3 different packages that can be great for, smaller, larger employers, and we can customize this. So, I was just on with a university today, and they said, we want you to come on site. We want you to help us develop this plan and customize something that works for us, our faculty, our staff, and our students, right? And everybody's going to have confidence in that. So that's what we do. I'll be happy to do that for anybody. Probably the easiest way just to get a hold of us, just to give us a call. And that number would be 855-542-9108. We'll get back to you right away. We'll set up an initial discussion. And if you think that we can help, then we'll take it from there. We've got over 125 companies just in the first week. Many large companies in the area across all industries, schools, government, property managers, high-rise, smaller companies, office, industrial. So it really goes across all industries because we're all facing this together. So if we can help, we'd love to be a resource. We're actually beefing up our team and resourcing that to be able to help folks because again, the demand has been pretty significant. So we want to be there for our community because we all need to get our businesses back working, but we've got to stay safe while we do it.
Absolutely. And I think it's important, as you said, you've got a lot of big guys, in there, but even the small guys, don't feel, that, you're too small or irrelevant. If you've got questions, it might be that, you're a much smaller group. We've got a really small office, but, one phone call might give me the information that I need, to take care of it. So small guy, pick up the phone, small girl, pick up the phone. It's not going to make the call. It can't hurt, anything. You guys are coming from a place of wanting to help, and so I think it's amazing what you guys are doing. I'm glad we got in touch, to be able to pull this together. I think this is going to be extremely helpful for a lot of people. Love to have you come back, give us an update where things are, down the road, because obviously, this is like the old, if you don't like the weather in Louisiana, wait 5 minutes, it'll change. If you don't like where we are with COVID, right now, wait 5 minutes, it'll change. So
I'd be happy to come back and, in a few days or some weeks, we should certainly have some real kind of proof statements on how this is actually working out, right? And the employers that we're working with and what we're learning from it. So I'm sure we'll continue to learn as we go forward.
Awesome. Well, thank you, Mark, for the time. I'll let you get back in fighting the good fight and tell everybody there we thank them for everything that they've done for us.
We appreciate that. Thanks, Brandon.
Thank you.